What if I told you that one of the most misunderstood aspects of male health after 50 isn't heart disease or joint pain? It's how we view our own sexuality. It's a topic most men shy away from, often buried beneath embarrassment or silence. But here's the truth. Your sexual health is not just about intimacy. It's about longevity, vitality, and control over your well-being. Today, we're breaking that silence with precision, compassion, and science. Whether you're here out of curiosity, concern, or a commitment to a healthier future, you've just opened the door to a powerful and eye-opening conversation. And by the end of this video, you'll understand exactly how one private habit, when used wisely, can either fuel your health or quietly hold you back. We're not here to judge. We're here to understand, reflect, and evolve. So, if you're ready for the kind of conversation that respectfully challenges assumptions, empowers your choices, and serves your greatest potential, then stay with me. This may be the most important and honest conversation about your health after 50 that no one else is having. Let's begin with a mature conversation, one that too often gets swept under the rug. If you're a man over 50, you've likely noticed some changes, physically, emotionally, perhaps even sexually. And today, we're going to talk about one of the most personal aspects of male health, masturbation in the later stages of life. Now, before we dive into this topic, let me be absolutely clear. This is not about shame, and it is certainly not about judgment. This is about honesty, about health, and about understanding your body. It's a conversation rooted in science and compassion, not fear or stigma. Unfortunately, in our culture, we rarely talk openly about male sexuality as it relates to aging. When we do, it's often reduced to punchlines or vague suggestions that desire simply fades with time. But this couldn't be further from the truth. Male sexuality doesn't vanish with age. It evolves. And learning how to work with those changes is essential not only for your sexual health, but your overall well-being. So, what actually happens as men age? What role does self-pleasure play in navigating those changes? And where does that warning in the title come in? Let's take a clear-headed look at all of it, physically, psychologically, and holistically. After the age of 50, the male body naturally begins to transition. One of the most significant changes lies in hormone levels, particularly testosterone, which gradually declines as part of the normal aging process. What does this mean for you? You may notice that arousal takes a little longer, or that physical sensations feel different than they did in your 30s. I want to stress this point. This is not dysfunction, it is physiology. It is your body adapting to a new phase of life. Now, here's the critical distinction. Sexual desire doesn't disappear, it simply transforms. Instead of purely reactive, spontaneous desire, you may find it becoming more contextual and emotionally tied. And here's where solo sexual activity, masturbation, takes on new and empowering meaning. Masturbation in your later years isn't just about release. It becomes a way to remain connected to your own sexual identity on your own terms, without external pressures or expectations. It becomes a more nuanced, mindful, and introspective practice. It's an opportunity for men to practice self-awareness and acceptance, to understand the new rhythms of their body, and maintain a sense of intimate comfort with themselves. So let's talk about benefits. Real, medically and psychologically backed benefits that are rarely discussed in public forums. Physically, regular masturbation functions much like any form of exercise. It promotes circulation, particularly in the genital region. This increased blood flow is vital for maintaining the elasticity and oxygenation of tissues, preserving the integrity of nerves and small blood vessels that are essential for erectile function. Just as muscle tone relies on regular use, so too does sexual health. Studies have shown that regular sexual activity, including masturbation, may reduce the risk of erectile dysfunction by supporting the smooth muscle function of the corpora cavernosa, the erectile tissue within the penis. Interestingly, research also suggests that this type of stimulation can help prevent penile atrophy, a little known but genuine concern for many older men. In short, staying sexually active on your own terms helps preserve physiological responsiveness well into advanced age. Now, some men might come across natural techniques to restore erectile firmness, 7-second exercises, or blood flow restoring methods. While many of these tools may show potential, it's essential to approach them with a critical eye and ideally under medical guidance. Methods targeting pelvic floor muscles or promoting vascular health can complement, but not replace, an overall lifestyle that supports circulation, including aerobic exercise, weight management, and heart health. Now, beyond the physical, we have the psychological dimension, which in many cases is even more impactful. As men age, it's not uncommon to experience shifts in self-confidence, particularly related to body image or sexual performance. Masturbation, in this context, can become a quiet act of self-affirmation. It's not indulgence, it's reassurance. A way to reaffirm that your body remains responsive and capable of pleasure. It encourages a healthier body image and restores a sense of agency, especially important during a life phase where many feel they're losing control, whether over their careers, their relationships, or even their health. And just like with any ritual of self-care, masturbation also offers emotional regulation. In an age crowded by stress, transition, and sometimes isolation, it provides a release, a balanced neurochemical reset. Dopamine, oxytocin, and endorphins released during climax all contribute to lowered stress levels, improved sleep, and in some cases, a decrease in depressive symptoms. But here is where wisdom is required. With all the benefits, we must also speak honestly about the risks, not of the act, but of the mindset behind it. The true danger is not the practice of masturbation. It is when masturbation becomes compulsive. Let me explain. When any pleasurable behavior transitions from conscious choice to compulsive habit, it loses its health benefits and begins to cause harm. Physically, overstimulation can lead to sensory desensitization. The nerves that provide pleasure can become dulled when consistently exposed to excessive stimulation, especially via high-speed pornography or aggressive touch. This almost mirrors an addiction-like tolerance effect. Your baseline response weakens while your brain continues to chase novelty or intensity. This can result in a condition known as delayed ejaculation or even an inability to achieve climax through standard intimacy. But even more serious is the emotional risk. Compulsive masturbation often becomes a coping mechanism, a substitution for connection, comfort, or emotional processing. Studies in behavioral psychology show that men who struggle with anxiety, grief, depression, or loneliness may resort to solo sexual behavior not in the spirit of exploration or pleasure, but in order to disconnect and numb themselves. Behind the neurochemical reward of climax, there can sometimes be a deeper human ache, an unmet emotional need. And when masturbation becomes the primary outlet to soothe emotional discomfort, it begins to erode motivation for life's other pleasures: friendship, creativity, communication, meaningful relationships, and physical health routines. This is what we refer to as lifestyle displacement. Instead of calling a friend, taking a walk, journaling, or reaching out for help, the path of least resistance becomes the solitary, momentary fix. And over time, it creates cycles of shame, isolation, and self-doubt, further perpetuating the behavior. So, what's the way forward? It's one word: balance. There is nothing inherently wrong with masturbation. In fact, when practiced with intention, it can be one of many tools for maintaining emotional equilibrium and sexual vitality. But it should exist within a broader context of health, a well-regulated lifestyle that supports connection, sleep, nutrition, intellectual stimulation, physical movement, and emotional resilience. Ask yourself honestly, is this practice enhancing your quality of life, or is it a substitute for something you're avoiding? Do you feel calm and centered afterward, or guilty and hollow? Are you engaging out of curiosity and connection to your body, or to escape feelings you don't want to address? Your goal should always be integration, where sexual expression complements your full, evolving life. And if you're at a point where you're unsure, if this habit feels too frequent or emotionally numbing, I encourage you, talk to someone, a therapist, a medical professional. Let me assure you, seeking guidance is not weakness, it's strength. It is emotional intelligence in action. To bring this full circle, masturbation is natural, it is healthy, and it is often misunderstood. At any age, but especially after 50, it can be a therapeutic part of your self-care routine when approached mindfully and with awareness. That's the real danger, not masturbation, but the loss of balance. So honor your body. Stay connected to yourself. Embrace your evolving sexuality without shame. Align your habits with self-respect and curiosity, because that's what it truly means to age with strength and dignity. Thank you for taking the time to engage in this honest, science-backed conversation. If you found value in this perspective, I invite you to continue this journey with us, exploring the body, the mind, and the full spectrum of human health with integrity. Be well, stay wise, stay curious,